Lower blepharoplasty revision. 8 months ago, I had an upper and lower blepharoplasty. My surgeon also lifted the outer corners of my lower eyes as they hung below my pupil. He also did CO2 resurfacing below my eyes. My eyes look awful with bags. It's as if I never had surgery at all. I have an appointment coming up with my doctor, and I wish to be more educated on revisions before I spend even more money. Is it reasonable to expect this repair to be done at discounted charge or no charge? Thank you so much for your help.
Thank you for your question. It's understandable to be concerned 8 months after your surgery about the appearance of your eyes. And I could tell you, as an oculofacial cosmetic surgeon with a practice that is mostly cosmetic, even with the reconstructive procedures that come to me being still cosmetically inclined, that about 20% of our practice is revision surgery, and eyelid surgery, ranking in the number of and the hierarchy of plastic surgery procedures, being highly common, it is understandable that a certain percentage of people don't have the ideal outcome, and there are many, many reasons for that. One of the things that I'm going to address with you is, by looking at your photos, the skin quality almost has a certain appearance consistent with photoaging, which is sun exposure, and possibly also smoking, whether it's primarily as a smoker or as secondhand smoke. Now that's about the texture and quality. But really what is a clear issue is the way the lower eyelid is sagging on the outer aspect and coming down. Now, without doing a physical exam, it is important to at least assess on your own whether, if you pick the corner of the eyelid up, if the eyelid just looks a lot better. And that's a benefit that I don't have with just looking at your photos. But it's almost, when I look at your photos, I want to just pull that lower eyelid up and give it a little tightening. Now, there's a structure of the eyelid called the lateral canthal tendon, and it's a very important part of the anatomy and support of the eyelid. And in our practice, it is typical to do some type of tendon supporting procedure, particularly when someone is going to have several procedures that could affect the position of the eyelid. And so I think that it's probably going to be warranted in your case to have a procedure like that, something called like a lateral canthoplasty, canthopexy, lateral tarsal strip. There's a lot of terms and phrases, but the key element is the reconstruction or reinforcement of the lateral canthal tendon. And this is a tendon that actually attaches the eyelid to the bone. And so, in order to make sure the eyelid is stable, unfortunately, just lifting up the skin and attaching it to the skin doesn't give it that stability, and invariably that tends to pull down. We see a lot of patients who come whose upper lids are actually tethered to their lower lid because their previous surgeon had actually pulled the eyelid up and then stitched it in a way that pulled the upper eyelid down in an attempt to stabilize the position of the lower eyelid. So, in most of these types of referrals, I always encourage our patients to first communicate with their primary surgeon. Part of what we do in cosmetic surgery is the reality that a certain percentage of patients need revisions, and no surgeon has never had to do revisions. If one of our mentors in our field said, a surgeon who claims never to have to do revisions is doing one of two things: either they're not doing surgery or they're just plain lying. So I don't think you necessarily have to start exploring the later part of your question about costs and and the costs of revisions and things like that without first communicating with your doctor and getting your doctor's sense of comfort on whether or not this is the procedure that your doctor feels qualified or experienced to do. A lot of times, really good surgeons will have relationships with other surgeons who have more experience in other areas. It's very difficult for one surgeon to be brilliant and exceptional in every area. So there is nothing wrong with you having another specialist do some work if there is a clear communication and understanding between you, the original surgeon, and the referring specialist, if that needs to be the case. But again, I would say that if you're first see if your doctor feels comfortable and confident, but certainly from the pictures that you've submitted, a revision of some type is clearly indicated just from those photos. So again, to summarize, you need some type of support in order to get the lower eyelid into proper position and to address the draping of the skin that has come down. And that procedure is to attach the lower eyelid back to the bone, the orbital rim, and has several different kinds of names, but essentially it's called lateral canthoplasty or canthopexy. And it's really to stabilize the position of the lower eyelid. So I hope that was helpful. I wish you the best of luck, and thank you for your question.